we are now going to start by getting an update on the latest news from the Mercury Challenge. And this, as you probably know by now, is the largest international study of feline hypertension with more than 10,200 cats. And we're going to do this with none other than Dr. Andy Sparks. And he will present his thoughts very generously. And then afterwards, he will be here to answer some questions from you. So if you have questions, make sure that you post those in the Q&A. But before I let him in and before I introduce you to him, I would like to ask you a question. And the first one is, and this is sort of like a Scouters cross your heart kind of question, do you, in fact, measure blood pressure regularly as a routine on older, healthy cats? And older, I guess we are talking about 7 years and older. So you should have that question up there now. And in a little bit, I will also post another question saying that how would you rank the benefits of measuring, of doing this? So there will be a second question for you to answer, and I will review those answers with Andy afterwards. So Andy Sparks, he is a feline specialist with many years experience in clinical practice and in referral clinical work. He is the founding and current co-editor of the Journal of Feline Medicine and Surgery, a diplomate of the European College of Veterinary Internal Medicine. He's been the veterinary director of International Cat Care and International Society of Feline Medicine for a number of years. He has authorized numerous scientific publications and book chapters in the field of feline medicine and is now also operating as if he didn't have enough to do as an independent consultant. And he's here to talk about the Mercury Challenge. So please welcome Dr. Andy Sparks.
Firstly, a big thank you to Ceva for the opportunity to share with you today. I'm going to be looking at blood pressure measurement in cats and some of the challenges around this concept of measuring blood pressure and managing hypertension. In particular, I'm going to be looking at some of the results from the Mercury Challenge. This was a pan-European study that was initiated by Ceva, a survey simply looking at blood pressure measurements that were collected in more than 10,000 cats from different countries across Europe. So just to begin with, setting the scene, we know that hypertension is a common problem in cats. This is the results of 5 different surveys that have been published in the literature. Generally speaking, cats over 6 to 9 years of age, we know that the prevalence of hypertension is probably at least 10% in those cats. It tends to increase as cats get older, but you can see this is a common clinical problem. Yet despite it being a common problem, we're not that good at measuring blood pressure in cats. This was a survey that was done by Ceva in the UK just a few years ago, asking a number of different veterinary clinics in the UK what they thought the importance of measuring blood pressure was. So these clinics were asked, do you think it's important to measure blood pressure in senior cats as part of a routine check? And nearly 90% of those clinics responded that yes, they thought this was an important thing to be measuring. And yet when you looked at the proportion of those clinics that were actually measuring blood pressure at routine checks, it was less than 20%, less than 1 in 5. This is another study that was published looking at more than 350,000 feline consultations in the UK. So this study looked at the number of those consultations where blood pressure was measured as part of the routine consult. Overall, that was less than 1.5%, so a very low proportion of those routine consults included blood pressure measurement. And even in cats 9 years of age or greater, where the prevalence of hypertension we know begins to increase, it was still less than 5%. When the results of those studies were also looked at by age, we can also see that the prevalence of hypertension did increase markedly with age. So from around about 9 years of age onwards, as we would expect from other studies, the proportion of cats where blood pressure was measured that had hypertension began to rise quite sharply. And in older cats in particular, proportion where hypertension was diagnosed was really quite high. So it's a common disease, yet we're not very good at routine measurement of blood pressure. Why is that? Well, I think there's all sorts of common barriers to blood pressure assessment. Lots of different reasons that clinics find it perhaps challenging or difficult to engage with routine blood pressure measurement. And I want to just look at some of these problems and potential solutions to these barriers as we go through this presentation. First thing is, what equipment should I use? And I'm not sure that I've got the right equipment to be measuring blood pressure in conscious cats, so I really don't want to engage with this. Well, essentially, there are 3 different types of equipment. We are looking at non-invasive blood pressure measurement when it comes to measuring blood pressure in conscious cats, and there are 3 main forms of equipment. That's traditional oscillometry, Doppler, and high-definition oscillometry. Those are by far the most common 3 techniques that are used. Most of the data that has been published has been using one of these 3 techniques. And the honest answer is, it doesn't matter. Whatever equipment that you've got, if you're using it, you will get some results. And those results should be pretty reliable. It is very important to always try and use the same equipment in an individual cat, because the results of blood pressure measurement will vary from one piece of equipment to another. So it's important to try and use the same equipment. If you're going to be buying some new equipment for use in the clinic, it's worthwhile trying to make sure that the equipment has been validated for use in cats. So ask the manufacturer to look at validation data. But essentially, all of these 3 techniques should be able to measure blood pressure in cats. Along with using the same equipment each time, we should be measuring blood pressure at the same site. Whether that's a forelimb or a hind limb or a tail, we know again that the blood pressure measurement will vary depending on the site that we measure it. So always use the same site. And the cuff size, the width of the cuff should be around 30 to 40% of the diameter of the limb or the tail where you're going to be applying the cuff. Again, we know that that results in greatest accuracy of blood pressure measurement. Once again, some of these techniques will allow you to measure mean arterial pressure or diastolic arterial pressure, but we know the only reliable measurement from any of these techniques is systolic pressure. So we should always be recording and using the systolic arterial pressure. Now, it's certainly true that the Doppler and high-definition oscillometric equipment may be more successful. There will be fewer cats where we fail to get a reading. That's because these types of equipment are more suited to the higher heart rates and smaller blood vessel size that we see in cats. And there is also evidence that if we're using high-definition oscillometry, it may be better to use the tail base, where we are less likely to get artifacts from movement, muscle movement. But essentially, all 3 types of equipment can be suitable for measuring blood pressure in cats, and we can get valid readings. So again, we want to try and keep every variable as constant as possible when we are measuring blood pressure in cats, and we are always aiming to get 5 stable readings of systolic blood pressure and use the mean of those 5 readings as our measurement of systolic pressure. Just to illustrate that these different equipments can measure blood pressure differently, this is looking at the data set of cats from that Mercury challenge study. We're looking here at nearly 2,000 cats where 5 systolic blood pressure measurements were taken, and we're looking at the mean of 5 readings. These cats were otherwise healthy as far as we could tell, and this just shows the difference between Doppler readings and oscillometric readings, and you can see that oscillometric readings were significantly higher than Doppler. Not a huge difference, but around about 12 millimeters of mercury on average. Now, these weren't the same cats, these were different groups of cats, but because we're dealing with quite large numbers here, this probably does represent a true difference. But it just illustrates that different equipment will measure blood pressure slightly differently, so we should always try and use the same equipment each time when we're measuring blood pressure in the cat. Another common concern about measuring blood pressure is simply the time it takes. Don't have time to measure blood pressure during a routine consultation. Well, I think the honest answer to that is, how important is it to you to be measuring blood pressure? If you think that this is really an unimportant technique and unreliable, then you're probably not going to bother. But if you think that it is an important thing to be measuring blood pressure, particularly in older cats, you'll find time to do it. After all, what else do you not have time for in a routine consultation? Do you not bother to weigh or do a body condition score? Do you not bother to do ophthalmic exam or neurological exam when that is indicated? Do you not bother to auscultate the cat or draw blood? Well, really, the answer is clearly, if we think that this is an important part of the clinical exam, we will find time. And importantly, this technique of measuring blood pressure doesn't have to take a lot of time. This is again looking at the results of the Mercury challenge, this pan-European study. We're looking at over 4,000 measurements of blood pressure done simply in primary care practice. Roughly 56% of these cases they were using oscillometry, 40% using Doppler, and you can see that in around 45% of cases it took less than 5 minutes to get 5 blood pressure readings that were stable. Around about 90% of cases were achieved within 10 minutes. So it's only a minority that take longer than 10 minutes to get a valid blood pressure reading. So this helps to illustrate that this is not a difficult procedure. It is not something that in most cats takes a long time to achieve. And of course, the more experienced we are at measuring blood pressure, the better trained we are, then the quicker this procedure is likely to be. So good training, good experience, good handling of cats results in better repeatability and reproducibility and a quicker procedure. So in this sort of environment, often a nurse, an empathetic nurse, a nurse who is good at handling cats together with the owner could be your best asset, because the nurse together with the owner could go into a different room and could measure blood pressure quite separate from the routine consultation. So there are ways that we can overcome these problems, but fundamentally this is not a technique that takes a huge amount of time. So what about this problem, stress? We often hear, well, cats just get too stressed in the clinic, so measuring blood pressure is simply not going to be reliable. Well, it is true, cats can get stressed in the clinic. It's equally true that humans get stressed when we go to see our doctors, our healthcare professionals. The phenomenon of white coat hypertension is very well recognized in human medicine. Would we be happy if our doctor, if our healthcare professional said, well, I'm just not going to bother measuring your blood pressure because you might be stressed, I'm not sure how reliable it's going to be, so we just won't bother. Even though you might be at risk of hypertension, I'm not going to bother. Well, I think we would feel that would be pretty poor clinical practice if that was said to us during a consultation. And the answer is simply, we can make this more reliable. We can engage with ways to try and make the environment in the clinic much more friendly towards cats, much less stressful. So we do want to try and keep things calm. We want to use handlers that are empathetic with cats. We want to have a quiet room. We want to have a room away from barking dogs, for example. We want to allow the cat a few minutes to acclimatize to the environment, perhaps use their own bedding to sit on whilst we measure blood pressure, perhaps use Feliway diffusers in the room. And if cats are getting stressed, just consider ways that we can reduce that stress. Is our time too pressured? Is our attitude wrong? Is our handling of the cat wrong? Are there things that we can do to improve the environment? So Natalie's going to be talking about cat-friendly clinic principles later on, and these are really important when it comes to measuring blood pressure. But we know for sure that stress does play a part. Again, this is the results from the Mercury challenge study. Those cats that had their blood pressure measured, the clinicians involved were asked to make a subjective assessment of the stress of the cat. Were they calm? Were they anxious? Were they nervous? And you can see that the mean systolic blood pressure did vary between those different groups. On average, calm cats' systolic pressure was 142 millimeters of mercury, increased to 153 for anxious cats, 161 for nervous cats. We can take this into account when we're measuring blood pressure. If cats seem very nervous, if they appear to be stressed, we can take that into account and appreciate that the blood pressure may be a little bit higher, but it's not a reason not to measure blood pressure. This is another study that was published in 2017, a study that was conducted at the Royal Veterinary College in London, 780 healthy cats at a couple of rehoming centres, and they found exactly the same thing, that subjective assessment of stress showed that cats that appeared more stressed tended to have higher blood pressure measured. And of course, looking at the results of the Mercury challenge, those cats that are more stressed, it tends to take longer to measure their blood pressure. So another reason why it's a really good idea to try and make the environment as calm and as stress-free as possible. But this is not a reason to avoid measuring blood pressure. Some clinics suggest that it is simply not financially viable to be routinely measuring blood pressure in cats. And I think the simple answer to that is that we've got to get our financial model right. The capital equipment cost for measuring blood pressure is actually really pretty low. This should be a high volume, low cost procedure. The equipment is relatively low cost, it lasts for a long time, so we don't need to be charging a huge amount for measuring blood pressure. If we make it a high cost procedure, if we're charging 30, 50 euros per measurement of blood pressure, it will only ever be a low volume procedure. We'll miss many cases and many opportunities to treat cats for hypertension. That's poor standard of care, that's poor cat welfare. So we want to make this a low cost routine procedure. Do we charge extra for weighing a cat, auscultating a cat, performing an ophthalmic examination? We need to be thinking carefully. We want to make this a low-cost, high-volume procedure so that we can identify cats with hypertension and we can monitor and treat them appropriately. So it should be a routine, low-cost procedure. And we know from epidemiological studies that have been conducted that there are a number of situations where we should be measuring blood pressure. We know that most cases of hypertension in cats are secondary to another disease, commonly things like chronic kidney disease, hypothyroidism, primary aldosteronism, less commonly perhaps things like hypercortisolism, pheochromocytoma, etc. So wherever we see an underlying disease that we know predisposes towards hypertension, we should certainly be measuring blood pressure. Additionally, if we see evidence of target organ damage, we know that there are 4 target organs that are susceptible to damage as a result of hypertension. Ocular signs, cardiac signs, particularly left ventricular hypertrophy, renal disease itself, and also neurological signs, central nervous system disease. These are the target organs. If we see changes there that could be associated with hypertension, we should be measuring blood pressure. And as we've already said, hypertension is an age-related disease in cats. So the older the cat, the more important it is to be routinely measuring blood pressure. There are guidelines that are being published that suggest in adult cats, perhaps 3 to 6 years of age, we should consider measuring blood pressure on an annual basis more than anything to get a baseline for that individual cat. Cats that are 7 to 10 years of age, probably we should be measuring blood pressure yearly in those cats to monitor for hypertension. And cats over 10 years of age, at least once a year, possibly twice a year, we should be routinely monitoring for changes in their blood pressure. That takes us on to how do we know when to treat a cat for hypertension? This is again another clinical conundrum to an extent. How do I know when I should be treating a cat? Well, we need to take a sensible approach. There are no absolute cutoffs when it comes to blood pressure values. You need to know what sort of normal values you get in your clinic, in your clinical setting. Ideally, we need to know what are the cat's previous blood pressure readings. When that cat was completely healthy, when it was an adult cat, a young adult cat, what were the blood pressure readings and what does the reading now compare with for those previous readings? Is there any evidence of target organ damage? Is there any evidence of predisposing underlying disease? Again, from guidelines that have been published, we know that the risk of target organ damage, if the systolic pressure is below, say, 140 to 159 millimeters of mercury, risk of target organ damage is really very low. It rises to a moderate risk when blood pressure is between 160 and 179. And if the systolic pressure is sustained at 180 millimeters of mercury or above, then we have a much higher risk of target organ damage. So that allows us to begin to think about categories of cats where we want to treat. Do we see evidence of underlying target organ damage? Do we see evidence of underlying disease? Again, in that Mercury challenge study, this just shows the prevalence of high blood pressure above 180 millimeters of mercury in cats that were diagnosed with chronic kidney disease. You can see nearly a third of them had high blood pressures, and in cats with hypothyroidism, over 20% of those cats had high blood pressure readings, illustrating that where we have these underlying diseases, then hypertension is much more likely to be diagnosed. So generally speaking, if the systolic pressure is above 140 to 150 millimeters of mercury, and there is evidence of either ocular or neurological target organ damage, which can be severe and can cause significant morbidity. So if there's evidence of ocular neurological target organ damage, systolic pressure is above 140 to 150, that is sufficient evidence to try trial therapy and to monitor those cats. Perhaps more commonly, if the systolic pressure is 160 millimeters or above, and that's repeatable, and there is any evidence of target organ damage, so that would include ocular, neurological, left ventricular hypertrophy, evidence of kidney damage, that would be sufficient to initiate treatment and monitor the cat. And if the systolic pressure is 160 millimeters or above on at least 2 occasions and not thought to be associated with any white coat hypertension, any stress, then again that would be sufficient basis to trial therapy for the hypertension and to monitor the cat and to see what response is achieved. So in terms of actually managing and monitoring these cats, amlodipine is well recognized and widely recognized as the treatment of choice for managing hypertension in cats. If the initial systolic arterial pressure is below 200 millimeters of mercury, then we would initiate treatment with a standard dose of amlodipine. That would be 0.625 milligrams per cat once a day or 0.125 milligrams per kilogram once a day. And those cats we would initially perhaps monitor once a week. So not hugely intensive monitoring, but perhaps monitor once a week and adjust treatment. So our aim would be initially to get the systolic pressure below 160 millimeters of mercury. If we're not achieving that after 7 days, we would double the dose of amlodipine, and we can continue increasing up to a maximum of 2.5 milligrams per cat per day or 0.5 milligram per kilogram per day. If we're still not achieving our aim of blood pressure below 160 millimeters of mercury, we should check compliance, make sure that the owner is able to administer the drug properly, and if we're convinced that the cat is receiving the amlodipine, then perhaps consider adjuvant therapy if needed. On a long-term basis, we would advocate monitoring these cats perhaps at least every 3 months, so at least 4 times a year, aiming to try and keep that systolic pressure below 150 to 160 millimeters of mercury, but above, say, 110 to 120 millimeters of mercury. We don't want to drop it too low, although that would be pretty rare with amlodipine therapy. Also, of course, monitoring for target organ damage and any underlying diseases. Now, if we have a cat where we diagnose hypertension and the systolic pressure is above 200 millimeters to begin with, then we would start on a higher dose of amlodipine. Generally, we would start on a double dose of amlodipine, 1.25 milligram per cat per day or 0.25 milligrams per kilogram per day, and monitor them a little bit more closely, perhaps every 1 to 3 days, aiming to achieve that initial target blood pressure of below 160 millimeters of mercury, simply because at that level of blood pressure, above 200 millimeters of mercury, we stand a higher risk of significant morbidity. So we want to try and reduce that blood pressure as quickly as possible. So as we've said, amlodipine is the treatment of choice. Many studies have shown that this is a very valuable drug. It lasts for 24 hours, so we only have to administer it once a day. Generally results in 30 to 70 millimeters of mercury reduction in systolic pressure, and is effective as a monotherapy in between 70 and 100% of cases. Where we need to, we can use adjuvant therapy, variety of different therapies that we can use. Angiotensin receptor blocker, telmisartan, would perhaps be the first choice in most cases. We can also use ACE inhibitors, things like benazepril, enalapril, ramipril, and in some cases we may want to think about beta blocker or even an alpha blocker, so atenolol or prazosin, in certain conditions where we have underlying causes for the hypertension. But in most cases, amlodipine on its own is going to be successful, or perhaps combined with telmisartan or an ACE inhibitor. There is actually very good evidence that where we diagnose hypertension and where that is treated and monitored appropriately, that we will see a decrease in morbidity and possibly also a decrease in mortality. Certainly we would anticipate managing hypertension well will result in decreased morbidity. We will see a reduction in target organ damage. That cat is going to be clinically in a much better place. We will be improving cat welfare by managing the hypertension well. This study also suggested that there is a reduction in mortality. That's something that we still need to explore more, how hypertension in cats relates to reduced lifespan. But this study at least showed good evidence that we get reduced morbidity and reduced mortality where we are diagnosing, monitoring and managing hypertension well. So I want to just finish up by suggesting my top tips for managing hypertension and for diagnosing hypertension in the clinic. And the first thing is to make sure that we take this disease seriously. If around 1 in 10 cats or more over the age of, say, 7 to 9 years old are suffering from hypertension, this is a common, prevalent disease. Simply for cat welfare, we need to be diagnosing these cats. If this is important to you, you will find a way of measuring blood pressure in cats coming into your clinic. If you're not convinced that it's important, if you don't really care that much about diagnosing hypertension and managing it for the welfare of the cat and for good clinical practice, if it's not important to you, you'll find an excuse. But if it is important, you'll find a way to do it. If we want to incorporate blood pressure measurement as part of our routine during our consultations, we need to make it easy. So we need to find ways of adjusting our clinical practices to make this as easy as possible. Find the right people to be involved in it. Find the right routines that mean you are able to routinely measure blood pressure during annual checkups. Find the right people to be involved. We need to make this as easy as possible and as stress-free as possible for the cat. So find the right environment and find the right people. Use cat-friendly principles when we are engaged in monitoring blood pressure. Where we identify cats that have hypertension, look for underlying causes. Treat those cats appropriately using the guidelines that we've already mentioned and monitor them. Follow up. Monitor these cats on a regular basis. We owe it to our patients and good clinical practice to monitor these cats over time. They are probably going to be on antihypertensive therapy for the rest of their lives, so we want to make sure that we've got the treatment right. Keep good records, monitor them. And if we do these things, then I think we stand a good chance of making significant improvements in the way that we diagnose hypertension and in the way that we manage it in our clinics. So thank you very much for listening.
Fantastic. Thank you so much for so generously sharing all that knowledge with us, Dr. Andy Sparks. And thanks for being here with me live now. How are you doing?
I'm doing very well, thanks, Trina. Great to be with you. Thanks for the invitation to be a part of this. Really exciting to be a part of it. I must say that just before we get into things, that analogy to the Eurovision Song Contest, somebody from the UK, that does not work well. Yeah, it's okay. France may have come second, but, nil point yet again.
Remind me never to be spontaneous again in front of a camera like this on an international audience. Well, I'm so glad that you're here, and I love your voice. You're just the soothing way that you just just hold our hand as we go into this whole area and become much more knowledgeable about all these things is really brilliant. So thank you for doing that. And I would like to, perhaps we should just start with that first question that we asked the audience. We were asking them if they were, do you measure blood pressure regularly on older cats? And we can see here that the answer is no, not yet, 70%, and yes, of course, 30%. And I think that there are two questions there, and of course I feel that you have in a way already answered that. But what do you think will be the main key factor that will break this trend or these statistics?
I think the really important thing is just for us to understand how important this disease is as a welfare issue for cats. Because if we really understand and are convinced and know that this is an important and frequent cause of disease, and that those cats are suffering as a result of it, just as humans do with high blood pressure. It's not a pleasant disease to be dealing with. So if we really understand that, then we are going to want to engage and we're going to want to do something about this. So I think the fact that 30% of people that are attending today are already measuring blood pressure routinely in older cats. I think that's fantastic. And it shows that we're dealing with a group of people that are already well engaged with this. But clearly, we've got work to do. As a profession, we've got work to do. There are many clinics that are not measuring blood pressure nearly as often as they should be. So, there are things we can do that will really improve cat welfare.
There was one question: why do it already at 7? Already at 7 at the years of age, and what are the benefits of doing it that early? Because they were actually starting at 10 year today.
Mhm. Okay, so firstly, if you're starting at 10, that's fantastic, because at least you have a point at which you are starting to measure blood pressure. I think all the studies that have been done, the data that's been published, looking at blood pressure measurements in cats and looking at the risk of hypertension, we know that that risk really seems to increase quite markedly from about 6 or 7 years of age upwards. So that's why in guidelines, life stage guidelines and that type of thing that have been published, it's commonly recommended that we do start to measure blood pressure in cats on an annual basis from 7 years of age and above. But even more than that, being able to interpret a blood pressure reading from an individual cat is, in a sense, as much of an art as it is a science. As I tried to explain in the presentation there are no absolute cutoff figures. But I want just to imagine that scenario. If you have a cat that you've been seeing for annual vaccination, for annual wellness checks, since it was a young adult, if you had had 2 or 3 blood pressure readings from that cat, maybe when it was 3 years of age, 5 years of age, and then at 7 or 8 years of age, you check the blood pressure again and you see it's markedly higher than it was before, that gives you a much better handle as to the significance of that value. You know that that's increased appreciably in that individual cat, helps you interpret that blood pressure value much better. So I think there are lots of reasons why measuring blood pressure at an earlier age is ideal, but I don't want to criticize any clinic that's starting to do it at 10 years of age. Whatever age we start, that's great if we're doing it on a routine basis, but there are other considerations perhaps as well.
Wonderful. Okay. Well, Andy, I have a couple of questions here, so I'm just going to sort of get them in there because I'm so thrilled that we have a little bit of time with you. There's one question that a lot of people have voted for. They want to know, can we give, and I apologize if I don't appreciate, that is not the word, pronunciate these words right, but can we give gabapentin before doing the BP?
Okay, that is a question that crops up quite frequently. And I'm not aware of any studies that have been done to look specifically at the effect of gabapentin on blood pressure in cats. But I would say, ideally, we don't want to be doing that. We know that gabapentin has an anxiolytic and sedating effect on cats. Now, we know too that clinically that can be valuable from the perspective of trying to reduce the anxiety of the cat coming into the clinic. So there are a lot of clinics, if they know that the cat is quite an anxious cat, they will administer gabapentin or get the owner to administer gabapentin before the cat comes into the clinic. That may help to keep their cat calm. But I think we need to recognize that it is a drug that does sedate the cat. It doesn't have this magical effect of relieving anxiety without any other effects at all. It does sedate the cat. So it is very likely that gabapentin would drop the blood pressure somewhat. So I think in an ideal world, I would say try to avoid using gabapentin if you want to measure blood pressure. But equally, I would say, if it's clinically important that that cat receives gabapentin to keep it calm, don't let that stop you measuring blood pressure. Just bear that in mind, that it may be a little bit lower than it would be otherwise without the gabapentin. But it's something that we do certainly need to look at more with some studies to see how much effect it does have on blood pressure. But ideally, try to avoid it. But if you have to give gabapentin, don't let that stop you measuring blood pressure.
How about the side effects with amlodipine? And
yeah, Amlodipine appears to be an incredibly well-tolerated drug in cats. So we very, very rarely see any significant side effects with amlodipine. I'm aware of just very occasional cases where blood pressure has dropped a little bit too low in cats on antihypertensive therapy. That in itself appears to be very rare. There have been occasional cases. I think there was a case report of amlodipine causing gingival hyperplasia in a cat. It may have been a dog actually rather than a cat, but essentially it has a very, very good safety profile.
What should I do if I have a cat already on hypertensive treatment, stable for a period of time, and then all of a sudden develops hypertension again?
Yeah, okay. So I think whenever you come across that sort of situation, the simple question that you have to ask yourself is what has changed? And that could be something in the cat, the environment, the owner, the administration of the drug. So I think there are a few things that you have to consider in that situation. Is the owner still administering the drug properly? So it's worthwhile checking with the owner, getting them to bring the tablets in, making sure that they're in date, doing all of those sort of routine checks. But otherwise, assuming that the cat is being maintained on good therapy and there's been no change in the therapy, then I think we've got to look for some change in the underlying status of the cat itself. So we're thinking about underlying disease. Has a disease developed that may be contributing to the hypertension? Maybe it wasn't a cat that had CKD before, but now that cat's developed CKD, or maybe it's developed hypothyroidism. So it would be important to do a complete reevaluation of that cat, essentially from a clinical perspective, to try and work out what's going on. We're not always going to find an answer to that, because hypertension sometimes is idiopathic, sometimes there are underlying changes that go on, and we simply can't find out exactly what's caused that. But certainly we need to go back to first principles and think about underlying diseases that could be contributing to that, doing what we can to identify those and manage the disease, the underlying disease, as well as the hypertension itself.
Wonderful. Wow, there's so many questions and we're running out of time. I think one last question that seemed to be have a great interest here is the Mercury study. Is it available anywhere?
Okay, so we are literally at the moment trying to put the finishing touches on all of the data and analyze all of the data as well as we possibly can. And we will then be looking to publish that. So it won't be available immediately, but we will try and publish that. And obviously, as soon as we are in a position to publish it, we will try and let everybody know about it. So the data's all in. The study effectively is closed right now, but we're just going through that process of analyzing it and getting as accurate results out of it as we can.
Wonderful. Well, thank you so much for participating and so generously sharing all your knowledge with us. We really appreciate that.
It's a pleasure. Thank you.
I give you 12 points.
We need it. We need it. Can I save that for next year?
Exactly. Well, take care of yourself and I'll see you soon.
Thank you.
Bye. And with us now, we would like to talk to a clinic that has participated very actively in Mercury Challenge. In fact, they were one of the top 3 Nordic vet clinics. Representing Veterinärshuset Öresund i Limhamn och Öresunds veterinärsklinik i Lund, we now have with us Christine Bestholm Jensen. Welcome, Christine.
Thank you.
Good to see you in person like this, or at least.
Yeah, exactly.
So tell us, this was really exciting to hear about all this. And now we are of course, curious, how does this work in real life? Tell me just first, why did your clinic decide to actually participate in Mercury Challenge?
I think it was a very easy decision, because we're both clinics that has a very high level of standard care for our patients, and we have a big heart beating for internal medicine in particular. in particularly. So we already do quite a lot of routine blood pressure measurements in both clinics. So I think to be able to contribute a bit to clinical research with this important information has been just really part of the game for us.
How was it actually to get the cat owners on board? Was it difficult, and how did you communicate with them to get them going?
I think it often is quite an easy to convince owners to do blood pressure measurements if you just do some basic owner education, telling them about these not very nice complications that can be a consequence of high blood pressure that you're not aware of. So Andy talked about target organ damage with respect to the eyes and heart and kidneys and potentially the brain as well. And I think most owners are really interested to do like best possible care for their older cats. So just like, and also I think like in comparison to doing routine blood tests, which is something that we quite commonly find it easy to persuade owners to do, I think blood pressure measurement should be like a lot easier to do because it's a non-invasive test and it's much cheaper compared to most blood tests as well. So I think it's like, yeah, it's fairly easy if you just take time to talk to your owners.
What did you feel were some of the benefits for you as a clinic to be part of this?
Definitely that we have practiced a lot and that we have put it up in quite a nice way to like get effective routines for blood pressure management. And all the nurses, or most of the nurses, feel quite comfortable now doing blood pressure in cats, even in anxious cats. I think another benefit is that you clearly see that the nurses, when they practice, they also get like critical judgment of the blood pressure measurements that they take. So they quite quickly get a routine in assessing what is like a true measurement and what doesn't really fit with the clinical picture. And I think as a clinic, especially if you're not like a large hospital and like a sort of medium-sized or smaller clinic, it's important to have several nurses feeling comfortable doing blood pressures because that could potentially be like I think that could stop you from doing blood pressure because you can't find the blood pressure nurse and she's occupied with another patient. And it's important that several people among the staff feel happy to do blood pressures and feel that they can do them well.
So it seems that there are some radical changes from the way that you worked before Mercury Challenge and the way that you work today.
Yeah, definitely. I think it's like just creating the routine is making it a lot less like a bother for the staff. Like as a medic, you often want to do a lot of diagnostics, and it's not always that your nurses are too happy about your great diagnostic plans if you're already 10 minutes late with your consult. So I think that they now know that this is most likely a cat that's going to have a blood pressure measurement, then they can already prepare for it beforehand. And in that way, we've created much more efficient routines with respect to blood pressure management after participating in the study.
Is there anything that you want to end it with, some advice for your fellow colleagues?
I think obviously, if you haven't got a blood pressure machine already, buy it. As Andy talked about, it's not a high-cost diagnostic tool, especially compared to the high throughput. We've been able to see that just in a year's time, we've been able to buy a new blood pressure machine. So we now have an additional one in the clinic because we can see that it quite quickly earns in the money. And also just take it get it at the back of the cupboard if that's where it's hidden, and use it as much as possible. I think what has really been a great help to us as well is that we have this like a template in the patient records, a bit like the form that Andy also showed with respect to putting in like the cuff size, which leg and the location, and whether the cat was stressed in the situation and so on. So we always collect like the same amount of info on every patient. I think that's a great help as well.
Wonderful. Thank you so much, Christine, for sharing all of that with us, and you have a good day.
You too. Thank you for
Bye.
sharing. Bye.
So, lots of information, and the question is now, how does one get started with this? And with us now, we have the corporate marketing manager at Ceva Animal Health, Catherine Garelli-Pa, and she is going to talk to us a little bit about some of the tools that Ceva can provide in order for you to get started.
Yes, good afternoon, Trine.
Good afternoon. So good to see you, Catherine.
Yeah, same for me.
So let's see. Let's see this. I think everyone is so excited now. We understand a little bit better what's going on here. We have a lot of potential clinics out there who could do better with this, or who could maybe embrace it a little bit more. What is it that Ceva can do to help in that process?
Well, regarding veterinarians and nurses, you know that so over the past 5 years, we as Ceva, we have developed quite a high number of tools that can be provided to veterinarians and nurses. In fact, the goal is really to be more confident in measuring blood pressure in the clinic. So we have this full hypertension training, that we call it like this. We organized it with a theoretical part, with explanations about the disease and all different things. And then there is also a practical part in this training where veterinarians or nurses can get trained and they train themselves on cats. For sure, this has been, I'm speaking at the global level, and then it's adapted in each different country. Clearly, the goal when you go out from this training is to be really confident and to be able to feel that you are able to implement it in routine practice. Especially, for instance, this is what we saw during the previous polls for regular checkups in senior cats, so age over 7 years old or even 10 years, as was saying Andy just before. If it's already from 10 years old, it's perfect. Then for sure, we encourage from 7 years old onwards. Aside from this training, we have several educational videos, many that we have done in collaboration with ISFM and with Andy Sparks as well, explaining the disease or the consequences and how to properly measure blood pressure. We also have some videos with Dr. Rosanne Jepson or Dr. Angelika Drenzler from Germany. And then every year, we are organizing a big initiative, which is called the Hypertension Month. And the goal is to raise awareness so among veterinarians and among cat parents as well. The thing is that we really want to encourage vets in measuring blood pressure, and we organize this event every year. So it's in May. So May is the Hypertension Month. So currently we are in the 4th edition of our Hypertension Month. And for this, we can provide the clinics with some posters that you can put also in the waiting room, with some detailers, with door signs and a lot of stuff to promote, in fact, this event in the clinic. And I think that the last initiative, which is the Mercury Challenge over the last 2 years, has been quite largely presented by Andy just before. And as he said, we hope to be able to publish the final results by the end of this year, if possible.
Now, we have a slide up there that also shows the communication, that what can help with the communication. Was that what you covered there as well, Catherine? Or?
Yeah, no, in fact, there is also, in this second slide, what we can see is that this communication is more dedicated to cat parents.
Exactly.
Also, to explain hypertension. So we have created a cat, Amadeus. He is our mascot. He is age of 7 years old. Unfortunately, he is suffering from hypertension. And then through several videos, he's the main character, and he explains in this cartoon what is hypertension and the consequences. We also have a video on chronic kidney disease, which is a concomitant disease that we can meet quite often with hypertension. And the very last one, the new one, which is about the first Mercury Challenge results that we got over the last 2 months. So we can also propose some leaflets to explain the disease to cat parents. And in some countries, and I know that this is the case in Denmark, for instance, Amadeus has his own Facebook page and community, and he explains the disease. He can answer to questions from the cat parents, and he is active on the social media. So what we really want is to make people understand that measuring the blood pressure in their cats is as natural and normal as measuring blood pressure, in fact, when they go and visit their physician. You cannot imagine not to have your blood pressure measured when you are visiting your physician. And in fact, when the cat is getting older, this is exactly the same thing.
Great, wonderful. And how do you see Ceva's work moving forward when it comes to hypertension?
For the future, we still know that there is a lot to do. And once again, this is what we saw just before with the results of the poll. The challenge for us and for veterinarians, because we know that it's not easy in a clinic, is to be able to implement this examination in routine and in everyday practice. But so we are here to support them, but we also want to make them realize that this is really a question of best practice. This will also, strengthen the relationship with the cat parents. You can also, when you are making this full checkup and examination, you can also detect other diseases. So we're speaking of practice, of best image, and we are also speaking of an increased revenue for the clinic. This is what Andy mentioned before. The thing is that not to have a very high cost for the exam, but more to capitalize on the fact that this will be a routine examination. But all of this is a global, in fact, aspect of hypertension and blood pressure measurement. And, anyway, we will still continue to support and train veterinarians and nurses. We will also probably propose a new edition of the Mercury Challenge to renew this initiative and be able to measure blood pressure in even more cats if possible. So really, yes, we have two things, early diagnosis, appropriate treatment. They are the key factors to fight this silent killer that is hypertension, in fact.
Wonderful. Thank you, Kathleen. And I think we're going to take a short break, but maybe we should watch the 2-minute video with Amadeus as a sort of an ending to this particular discussion. So thank you, Kathleen. And I will see you all back here in 10 minutes, but take a look at this video first.
Hello, I'm Amadeus. Do you remember me? Last time I introduced you to the risks of high blood pressure, the diseases that can go with it, and the importance of measuring my blood pressure regularly at the vets. Well, I now have the results of the biggest study ever conducted on cats and their blood pressure, the Mercury Challenge. The blood pressure of more than 10,000 cats in 20 different countries was measured. This included nearly 4,000 cats in the United Kingdom, 1,500 in Spain, 1,300 in Italy, 1,200 in France and the Nordic countries, and several more around the world. 40% of cats were found to have high blood pressure, with a blood pressure of 30% above normal. This study confirms that the frequency of the disease increases with age, with an average age of 13 years in cats with high blood pressure. Several other diseases may be associated with high blood pressure, such as hyperthyroidism or chronic kidney disease. In the Mercury Challenge, up to 1 in 3 cats with high blood pressure also suffered from chronic kidney disease. For example, I'm a cat with high blood pressure, but because I have no visible symptoms of high blood pressure, my illness goes unnoticed. High blood pressure is underdiagnosed and can have serious consequences in the long term, such as blindness. Ouch! It is therefore very important to talk about this during visits to the vet and to measure the blood pressure regularly, especially from the age of 7 years onwards. By detecting high blood pressure early, vets can prescribe a treatment to be given every day, avoiding any dramatic consequences. The study showed that 9 out of 10 cats were calm and cooperative when measuring their blood pressure, and it takes no more than 10 minutes. We are very cool cats, after all.